Hi, I'm Dr. Frank Shea with Denver Center for Bariatric Surgery at Skyridge Medical Center. Today, we're going to talk about bariatric surgery, which helps with type 2 diabetes and heart disease, but also helps people live longer lives. The typical morbidities that our patients face are type 2 diabetes, heart disease, hypertension, sleep apnea, and severe arthritis.
Hi, my name is Bob Bush and I live in Brighton, Colorado. The reason I considered weight loss surgery was because of the medical conditions that I was facing. I was extremely overweight. I had type 2 diabetes. I had high blood pressure. I had high cholesterol. I had sleep apnea, which meant I slept with a CPAP machine every night. If I took a nap, I had to have a CPAP machine. And worse, I had 2 stents put in because of coronary artery disease, which all were caused due to being overweight. That's why I considered this weight loss surgery as a solution.
Type 2 diabetes is a very devastating disease because it is a cardiovascular disease that damages the blood vessels to the heart, kidneys, and various other organs in our bodies. I reassured Bob about his procedure by telling him that the surgical risk is comparable to orthopedic surgery, but the consequence is that he will have a treatment for his heart disease and severe diabetes. Bariatric surgery is the only therapy that reverses type 2 diabetes because it actually changes the hormones that affect type 2 diabetes. We don't have any drugs or medical therapy that can control that yet.
The changes in my life since the surgery have been fantastic. I'm scuba diving again because I've been medically qualified to scuba dive again. I used to ballroom dance competitively. I've taken up ballroom dancing again and I'm going to compete in January. Being free of diabetes is probably the biggest change that's occurred for me. When I went into the hospital, my A1C was above 11. I was on insulin, I was on more oral medications. 2 days after the surgery, my blood sugar was normal. They stopped giving me the insulin shots because it was normal. After I got released from the hospital, we thought, well, maybe it was the liquid diet. When I started going back on solid foods again, my blood sugar stayed normal. My primary care has removed me off of insulin, removed me off of the oral medications. My blood sugar, when I tested, is in the normal range. As far as I'm concerned, now I'm not a doctor, but as far as I'm concerned, I am diabetes free, and that is the big change.
Obesity, like diabetes, is a disease, not a lifestyle choice or some kind of a character issue, but it is a disease.